Today we thought we will talk about what are the global trends in robotic surgery. At the very outset, I would like to pay tribute to Professor Senai, in whose memory Ramesh and other organizers have organized this event. And I understand this event is being organized, at least last year I also had an invitation to come. I very much wanted to be with you physically on this occasion. Nonetheless, I would have a great opportunity to talk to you. I did not have a good fortune to meet or know Professor Senai, but urge to meet him has dwindled because as it is told, the reflection of teacher is seen in his students. And when I see Ramesh, whom I know for so many years, the amount of work he's doing, the amount of dedication in disseminating the knowledge of laparoscopy surgery, and how he has pushed the boundaries, truly I can make a sense as a teacher myself what kind of person and personality and dedication Professor Senai would have. I would like to address the chairpeople, Dr. Sopinath and Dr. Aruna Rao. And again, I would be missing Dr. Senai, who we lost a very little while ago. You see in this slide, and most of it is dark. So every surgeon sitting here in hall would be concerned. One question would be haunting. If the robots take over or the technology takes over, what would be the future of surgery? And if you don't look at this picture clearly, you will see it dark. But look at the moon, which is shining. And the future would depend upon how we handle the technology and how do we actually mold ourselves to adapt the technology rather to keep cribbing the technology taken away surgical job. Now, one major question we should ask, because often I go around the country and world and I meet laparoscopy surgeons, like most of you are accomplished laparoscopy surgeons, and the question they say is, why should we have robot? It's an expensive tool. We can do everything with the help of laparoscope. Some of the colleagues in my audience would be my times also, when we had a similar argument between open surgery and endoscopy, or open surgery and laparoscopy surgery. If history is any testimony of what is going to be the future, then we need to have faith and we need to have a capacity to adapt ourselves to new technology, welcome new technology, rather than clinging to what is our comfort zone. Robot definitely augments the surgical skills of the surgeons and improve the patient outcome. Everything is centered to the patient. Whether you do laparoscopy or open surgery or you don't do surgery, you put yourself in a situation that patient is the center of the problem. All arguments die as long as the patient do well. Robot is one tool which recognizes the opportunity cost of surgeon's time, and that's why robots are very handy to do repetitive tools, repetitive tasks which surgeons don't have to waste their time. Seamless integration. Why robot has been accepted so quickly, adapted, its penetration is better than the cell phone in the world, is because it has a seamless integration. It's not a tool. It merges with the environment the surgeon is operating. It simplifies difficult tasks. All those you who have a little idea about robotic surgery, if you really want to approach a tumor or something which is sitting and cannot be approached two-dimensionally under vision, robot can be navigated to any site in the abdomen to achieve that objective. Compensates for human handicaps. Some of us are getting older, and so everybody would get old, and we should know that we will develop tremors. Still, we would love to do surgery. We would develop vision problems. Robot is the one which can filter your tremors, make sure that your tremors don't affect the quality of your surgery, including it compensates for your poor vision. no fatigue. All of you would agree, there is no disagreement on it, that once you have a day-long surgical list, in the evening you have a fatigue. Whether you accept it or not, in my own career as a surgeon for 40 years, the last case would be the sufferer, because you don't have that energy, and that's why we keep the lists in a manner that the last case is not, which would be affected by fatigue. Robot can work for 7 by 24, 365 days without any fatigue. And not robot only, any technology for that matter. Reduces error. And you see that 10% of the problems or deaths in the United States are because of surgical errors. If this can happen in United States, it's fortunate that we don't have a data, and it would be much higher outside United States, because the regulatory and the systems are so tight here. Despite that, human error is an accepted calamity for some of the complications. It creates another problem, related question, and it's not in relation to a surgical robot, it's in relation to any robot or technology. And these are the hard data. By 2025, annual creative disruption impact is expected to be 14 to 33 trillion US dollars, of which 8 trillion would be in health and manufacturing. This is Bank of America Merrill Lynch. 47% of the jobs in United States were at high risk of being substituted by computer capital. So naturally, if you look at this question, you would know that we would be losing job, and same thing could affect the surgeons, but it is not true. I would like you to take at this example, when ATMs were introduced, 20 bank teller jobs in 1988 dropped down to 13, but at the same time, because of the quicker output, 43% more branches were opened, providing more employment. Similarly, surgical robots have not decreased the number of surgeons, but have forced surgeons to learn and unlearn new surgical skills. So automation does not destroy jobs, it redefines job specifications. Now, take another example. All of you know that in '96, Kodak was on top, employing 145,000 employees. In a very short span, in 2012, the number of employees dropped down to less in single digit. The revenue in 1996 was 16 billion US dollars, and profit was 2.5 billion US dollars. Now, this slide is important to note. Kodak had 9 quarterly losses. Still, they did not win the sense. What brought down the disaster of this company? What disrupted it? A small company of 13 employees, Instagram, which was bought by Facebook for 1 billion US dollars, was responsible for making Kodak technology obsolete. And everybody said that 145,000 people lost their job, but it is not true. Truth is that it wasn't Instagram, it was the cell phone which disrupted the business of Kodak. And everybody, we don't need, now we have cell phones to take photographs, formal photographs, movies, etc. So, but imagine that in lieu of 145,000 jobs, how many jobs have been created by telephone industry? So don't be under the impression that technology eats away the job, but technology really tones you up for learning new tasks or doing things in a different way. Let us talk about what are the current robotic systems. This is typical Da Vinci operating room at Henry Ford Hospital, which was the pioneering place where the robotic surgery took birth. And let me tell you, this OT design was first time which intuitive never came. These are 3 big 3-dimensional screens which you can see with the glasses. So all those surgeons would appreciate it is not a tool. It is the whole ecosystem of surgical procedures have been changed. For the first time, even a junior most person can question the identification of a structure or a technique done by a senior surgeon. I wonder in our times how many surgeons will be able to see what was happening inside. Let's go to the next generation robot, Mako Striker robot, which would be very soon operating in India. Foundation's next venture is Mako robot after we establish the robotic surgery through Da Vinci. And Mako robot is much more precise in precision than anything. It is consistent. All of you would know, out of 150,000 knee replacements done, 100%, almost 100%, except for few are total knee replacement, including unicondylar injuries which are fit for partial knee resurfacing. But it is humanly impossible to match the normal anatomy with the human perfection. Even the expert surgeons would not be able to do. Hence, they were not able to do. But now with this, we can really, most of the surgery, if you watch, is done before the patient is taken to operating room. These are the 3D image reconstructions you see, where you can define milli or nanometer of the diseased cartilage or the bone to be removed. Nothing more is removed. And accurately, we can plan the size of the prosthesis. There is no if and but whether they would have the tension or pain. We can balance the tension. You see that the brown line shows the tension is high in cruciate ligaments. We can change the tension. We can do, and it's an absolutely precise and predictable outcome. This is ARTA's hair restoration robot, and which has totally put, at least in United States, the use of strips for hair transplantation out of place. You can very precisely pluck hair follicles. You can make holes to replant the hair follicles. So robots are getting into every surgical discipline. This is spinal robot and for brain surgery robot, which can precisely do the corrections, millimeter to millimeter. It can measure. It can do the screwing and fixing of the spine through the anterolateral position, which is very difficult for orthopedic surgeons. So this is again a robot which is getting popular, and we are negotiating with them whether we can bring it to India. This is a robot flex system, which is totally for transoral surgery. And this robot is really good for sleep apnea, posterior third tongues, oropharyngeal tumors, laryngeal tumors, and exclusively. So you will see that intuitive robot is a versatile system, Da Vinci system, which can be used for many disciplines. But now there is a trend for coming for disease-specific or specialty-specific robots. This is a new robot which is trying to come in competition with the intuitive robot, which is TransEnterix Robot. It has a single port system, SurgiBot. Unfortunately, it did not get an FDA clearance, but I want to show that all robots, new robots, ventures, are trying to do something which is not available in the Da Vinci robot, and that's why this robot is the one which has haptic feedback, means you can feel the tissue, which is lacking in the Da Vinci robots. The comparison between human and robots. Robots are certainly faster, consistent in our power output because it's mechanical. So it's not depending on the energy of hand or expertise. The power is consistent. Power is ideal for repetitive tasks, which would be boring for the surgeon, like suturing something. Robot can do much accurate suturing and can really be quick. Multi-channel information capacity robots have. Mind is focused on something. You cannot do 10 things at a time, but robot or equipment technology can do it. Memory access is restricted in robots. Human memory can be much more stronger. Poor reasoning and deductive. It is tedious. No error correction. Humans can, if we do a mistake somewhere, we can rectify it, but robots would go as they have been programmed. Quantitative pattern recognition is good, better in robots. Poor perception. Human perception is considered still to be better, but we know that how technology is running fast, and one day we may have a matching or better perception. Now, this is a revolution in the robot. The last thing I'm showing is that you know that two giants you would have heard of, Google and J&J, Johnson and Johnson, have made a company, joint venture by the name of Verb, and they are coming with the ecosystem. And Verb Surgical is developing a new robotic surgery platform. It is not a robot or a tool that will integrate technologies such as advanced imaging, data analysis, and machine learning to enable greater efficiency and improved outcome across the wide range of surgical procedures. It is causing every function of the surgeon, which surgeon needs to execute a job, would be technically done, and it is SRI's platform they have leased. All of you know that SRI is the one which have very successful bomb diffusion robot. So they have taken basic technology and they are creating, and it is going to be a low-cost procedure which every surgeon would be able to afford even in developing. This is Google and Johnson robot, and we are very keenly looking forward to this outcome because we'll show you how they are different than others. As you know that Google is master in neuronal networks and the data, and that's why they are using a lot of artificial intelligence in this. And artificial intelligence, for those who do not know this, is something like the neuronal connections in the brain. And how these networks work is there is an input layer. More data you put, the more better would be the output prediction. And then there are hidden layers, and then there are interconnections which is mimicking what you see in the brain, the neurons. And then different data points are given different automatic weightage to give you a predictive outcome, which is really an exciting thing. And artificial intelligence was known in 90s or 80s, but it decimated. But now it has come with full power because artificial intelligence needs only two inputs. One is high level of computing, which is now available, and number two is data points, which that's why you see that every social media tries to capture the data from you, and we become victim of giving them all the data in order to really enjoy the social environment. Yes, this is what I was trying to say. All of you are doing, the lowest layer is the red one, is the traditional minimally invasive procedures where you have access, you have manipulation, you have transaction capability, you remove the tissues, coagulation, closure, and anastomosis. Robot has advantage of wristed arm, 3D vision, current robot, precision, surgeon comfort. This is the only tool which has looked at the ergonomics and is kinder to the surgeon. Otherwise, it was always taxing for the surgeons to do complex surgeries. Access to deep angle spaces. Now, but the platform which I mentioned to you, which is the Verb company's program, they are doing data integration, they are doing image integration, they are reducing the OR footprints, they are doing the cost reduction and improved decision making using neuronal networks. Ladies and gentlemen, technology is there. Whether you like it or not, it will grow and grow as it is growing. In every field of the human, every walk of human life, it is going to grow in medicine also. The best thing would be to sense the winds and not to be caught napping. Now, people have started thinking, now, how can we save the profession? My wisdom says only two things can save a profession, our profession, and keep the supremacy or the patient-doctor relationship on top. And that is the human element of medicine. Unfortunately, it is getting snubbed very quickly, and people are getting mechanized. But only thing which will save you is the compassion or the empathy to the patients, and then human relationship. So I think focus on that, and I would very strongly recommend to the teachers that more emphasis should be given on that component rather than technology in order to tame the technology in the direction of advantage to the patient. So, what are the changes which we can sense in the education system? On the left-hand side, you have two pots. You know the process that they are made on a chalk through mud, and then they are dried and they are heated to cure them. Thereafter, once they have a shape, only they can break. There is no flexibility. Same thing is that we study medicine for 20 years and we become hardened to what we are being taught. It's too long a period to wait for your families, and that's why future medicine has to be flexible. That has to be two components have to be incorporated in medicine, that is, or any education, that is how to learn new things and how to unlearn, to adapt yourself to something new coming up. It needs a flexibility. Now, already there are portals. I have listed these portals: Udacity, Coursera, edX, massive online courses. They are using heavy artificial intelligence to do the courses, which are certified courses. And what is more important is they have personalized education. They tailor the courses according to need of the student. They are adaptive. New education policy is that the thinkers are telling it has to be adaptive. Means you should be able to change. It should not be hardened. And particularly it's relevant for medicine. It should be personalized. There is no point in giving the same education to 200 people in the class, but that is what the change which would come through the online education portal. It has to be flexible. It has to be inclusive. You can't teach them 20 disciplines and they are fighting with each other. Hypertension taught by pharmacologists has no relevance to hypertension taught by a cardiologist, or for that matter by an anesthesiologist. Teachers should act as mentors or facilitators. Teachers are not there to do spoon feeding, and they have to make sure and encourage the natural learning of the students. Learning to unlearn. This is very important. We are being fed right from childhood that learn, cram, memorize, but it's very difficult to unmemorize, forget things, or unlearn things. So this is a very important component of education. Nano courses, particularly relevant for medicine, that medicine is too long a course until we will break them into several courses which would give a vocational value to the student. A student studies for 6 months and starts earning something, maybe hypothetically studies anatomy and he becomes something in anatomy, teaches anatomy, and then he becomes surgeon by gradually going into. Otherwise, this conventional system of education is too risky, too long, and is not adaptive to the technology we are hoping we will have to face in future to come. So, ladies and gentlemen, finally, this is my last slide, and I want to tell you that don't be victim of circumstances. Take control of your life and sense the wind and frame your career according to the technology you come. Learn to leave your comfort zone. We surgeons are so fascinated about what we do, and we find it extremely difficult to open ourselves up to something better which could improve the outcomes of your patient. Thank you very much once again, and if there are any questions, I'll be very happy to answer.
How much time would it take to be affordable by more people in India?
Okay. Now, the cost is something, Ramesh, is a very, very variable factor. I was also very critical of the cost of these equipment, but once I'm here for 10 years and I see the amount of money spent in research and technology is something that out of 10,000 incubator companies, only one product would click. So they have a very high risk. But the technology the cost will come down as soon as there is a competition in the market. And that's why we are hoping that within next few years there will be 4 or 5 robots competing with, and next all robots are going to be directed towards markets like Indian markets, wherein the cost of surgery should not be matching with open surgery, it should be even brought down because we have the large volume of patients.
Thank you very much for your time and
Thank you very much, and once again our condolences, and I would like to thank my colleague Dave Meinhardt, who is really instrumental for giving technical support for this delivery. Thank you very much.
thank you, sir, and thank you.